Starting a home healthcare business in Missouri in 2026 can be incredibly profitable, but only if you build it the right way from day one. Most people don't fail because of lack of demand, they fail because they choose the wrong business model. So step 1 is choosing your type of care. In Missouri, there are 3 main paths. Home health, which is skilled care like nursing and therapy, usually paid by Medicare. Medicaid in-home services, which covers long-term personal care through state programs, and private duty, which is private pay care, often the fastest way to get started. Each one has completely different rules, staffing needs, and income timelines. Choose wrong and you'll face delays, audits, or worse, no cash flow. Step 2 is setting up your foundation before applying for anything. You'll need to register your business in Missouri, get your EIN, define your service area, and most importantly, build your policies and procedures early. This is where most new agencies make a critical mistake. They focus on marketing first, but Missouri regulators and referral partners care about one thing. Can you actually deliver safe, consistent care? Step 3 is licensing and compliance. If you're starting a home health agency, you'll go through the Missouri Department of Health and Senior Services. If you're doing Medicaid services, you'll need to enroll through MO HealthNet and meet EVV requirements. And if you're starting a private duty agency, there's no single license. But that doesn't mean no rules. It means your internal systems, your hiring, training, documentation, and incident reporting have to be rock solid, because in private care, your reputation is your regulator. Step 4 is staffing. This is the real bottleneck. If you can't recruit and retain caregivers, you don't have a business, you have a liability. The agencies that win focus on predictable schedules, clear training, and strong support systems from day one. And finally, step 5 is building your referral engine. Hospitals, clinics, senior centers, and local communities don't refer based on who markets the most. They refer based on who shows up consistently and documents properly. Here's the bottom line. Missouri is a high-demand market in 2026. But the winners are the ones who build compliance and operations first and scale second. If you do that, this can become a powerful, long-term business. Want hands-on help? Visit www.carepolicy.us today. We'll get you licensed, compliant, banned, ready to serve your community with confidence.